So now we're going to talk about addictions. The word addiction is often used to refer to any behavior that is out of control in some way. No one plans to become addicted. Many people think that they can handle their substance use, but when they want to quit, things aren't that simple. Abusers become dependent on the drug to help them function in society. There are two types of dependence: psychological dependence and physical dependence. Psychological dependence occurs when a person feels they need the drug to function with their daily lives, or they feel the drug gives them comfort in coping with the negative event that has happened. Physical dependence occurs when a person's body has adapted to the presence of a drug in response to chronic drug use. Drug must be administered for normal functioning, and removal of the drug will cause symptoms of withdrawal. It is important to notice the signs that someone close to you may be at risk of substance abuse before the problem gets out of control. Two important signs that a person's substance use is risky are harmful consequences and loss of control. Harmful consequences can range from mild to severe and can build up over time, affecting every aspect of a person's life by creating feelings of anxiety, depression, hopelessness, problems thinking clearly, and troubled relationships. Loss of control is demonstrated through compulsive use, cravings, and continued use despite harm. Abusers are often in a state of denial and feel conflicted between quitting the drug and the euphoric effects and relief it gives them. Healthcare professionals currently use the Diagnostic and Statistical Manual of Mental Disorders developed by the American Psychiatric Association and the International Classification of Diseases developed by the World Health Organization as a diagnostic tool to help define substance abuse and dependence in patients. I'm now going to talk about three particular addictions. Alcoholism. The three main treatments for alcoholism are detoxification, group therapy and counseling sessions, and medical treatment. Detoxification is the first stage of the treatment process. The objective is to remove all alcohol from the system in as safe as a manner as possible. This is done under professional supervision and in an inpatient facility such as ADAC Recovery Center. Therapy sessions and alcohol treatment are initiated after detox. Therapy sessions include group therapy and psychosocial therapy to deal with underlying psychological issues that are related to alcohol addiction and to help build skills to prevent relapse from happening. The most common medical treatments for alcoholism are naltrexone and acamprosate. Naltrexone reduces the craving for alcohol when taken in conjunction with normal drinking and blocks the euphoric effects of alcohol. Acamprosate restores the chemical balance in the brain that is disrupted by chronic alcohol abuse. It reduces sweating, anxiety, and sleep disturbances from the early stages of alcohol withdrawal. The next addiction that I'm going to talk about is heroin abuse. The most common treatment forms are harm reduction, detoxification, and rehabilitation programs. Harm reduction, for the principles of harm reduction, it accepts that abstinence may not be a realistic goal for some drug users, and the aim is to prevent adverse consequences of drug abuse. Such programs include needle exchange programs and safety injection sites. Detoxification is the process of completely purging the body of heroin. Recovering users will experience withdrawal symptoms such as abdominal pain, anxiety, chills, sweating, and weakness. And there are two types of rehabilitation programs: residential heroin rehabilitation programs and outpatient heroin treatment programs. Residential heroin rehabilitation programs has the individual leave their negative home environment and enter a safe zone where the focus is on their recovery. Residential treatment centers offer around-the-clock care, support groups, and programs to help maintain abstinence, such as exercise regimes, nutritional counseling, and holistic care. Outpatient heroin treatment, the individual attends heroin drug counseling during the day and then returns home in the evening. Therefore, they can continue with their daily lives while going through treatment. The two main forms of medical treatment for heroin abuse are methadone and buprenorphine. Methadone is a form of opiate substitution therapy. It removes drug cravings by not producing the highs and lows that many heroin abusers experience, and it's used for long-term management. Buprenorphine is another form of opiate substitution medication. The patient feels no drug cravings or symptoms of heroin withdrawal. It has low potential for overdose, and it blocks the euphoric effects of heroin. The last addiction that I'm going to talk about is nicotine addiction. The main common treatments for nicotine addiction are nicotine replacement therapy, medical treatments, and psychological support. Nicotine replacement therapy includes nicotine patches, gums, lozenges, and inhalers, which deliver doses of nicotine to reduce the unpleasant effects of nicotine withdrawal. Smaller doses of nicotine can be given to reduce dependence. There are also nicotine devices that people can use to help them with the behavioral aspect of nicotine addiction. Medical treatments will be discussed on the next slide, and psychological support is important to provide encouragement and support as a form of positive reinforcement for the individual who is planning to quit, as smoking cessation is one of the hardest habits to stop. The main common medical treatments for nicotine addiction are Zyban and Champix. Zyban is a smoking cessation treatment in adults, and it reduces the severity of nicotine cravings and withdrawal symptoms. Champix is another smoking cessation treatment in adults, and it decreases the desire to smoke because of the unpleasant side effects it creates. Thus, it creates a negative feedback mechanism where the smoker doesn't feel the need to smoke because of the negative side effects. Other common treatments that are prescribed to addictions are there to help with the comorbid diseases that are commonly present in substance abusers. These treatments include antidepressants such as fluoxetine, mood stabilizers such as lithium, low-dose antipsychotics such as olanzapine, and clonidine, which is used to help with withdrawal symptoms. Other non-pharmacological therapies that are used to help with addictions are psychosocial behavior therapy, cognitive behavior therapy, and support groups. Cognitive behavior therapy, the individual establishes links between their drug-seeking behaviors and alternate ways of coping with these triggers. And support groups consist of other recovering addicts to help one another cope and maintain abstinence. However, the most effective therapy is combining both behavioral therapies with pharmacological therapies into a comprehensive treatment plan that is patient-specific.